going on, everybody? So today's presentation is regarding MedBridge. It's an online platform that brings continuing education to the fingertips of the modern day healthcare professional and really revolutionizes the way that we learn and teach. So what is MedBridge? For those of you who are unfamiliar, it is an online platform that allows healthcare professionals to access continuing education classes and credits from the comfort of their own home or office. It allows the practicing clinician to generate home exercise programs and educational material for patients regarding their current conditions. And I think these are two aspects of this platform that are not normally utilized due to other free versions such as HEP2Go. But the whole thought behind this platform is to keep the clinician educated with the most up-to-date evidence-based research and keep them directly connected to the clinical care by allowing them to create home exercise program and treatment plans based on what they learn to improve their patient outcomes. So you can take the classes and then you can apply them directly to your patients via some educational tools and home exercise programs. So the first thing you're going to do is you're going to go into your web browser. And here, this is the main screen you'll see when you first go to medbridgeeducation.com. Up here in the top right hand corner, you're going to see a sign in bar. You're going to type in all your personal information, go to sign in. And from here, mine is a little bit different than a first time login because I've been using this website for a few months now. Besides the continuing education classes, which can be found up here, is the patient engagement section of this. And this is really important. They just recently added this, and I think it really makes this platform great to use. So the two components of that are the home exercise programs and the patient education. So let's go to patient education first. Let's say you wanted to educate your patient on shoulder impingement or any other condition that they might be going through. On the left-hand side here, you will see a variety of filters. So let's say you wanted to educate your patient on shoulder impingement. They've had some shoulder pain for a while, and this is what you think they have. So to educate them, what you can do is you can just click on this window right here, and it's going to bring them to the main page. And this is going to bring up a video that will really describe with anatomic models and just descriptions of the whole condition what's going on. And at the very bottom here, there is a description that sort of describes what's going on and just goes along with the video for a variety of different learning types, whether they're visual, whether they're audio, or whether they just like to read or see. So you can then add this to their home exercise program by clicking to add to home program. And you'll see on the right hand side here, this has already been added in as soon as you click it. And it's loaded, it's underneath an access code, so everything's already saved right there. The next component of this is the exercises, which as you can see, it already brought you to the screen, but you can also access it through patient engagement home exercise programs. And right here on the left-hand side, again, you'll see a variety of filters. Say you want them to do an isometric shoulder exercise and you want them to do external rotation. You can just left-click and drag this right over to the program, and it's going to be stored right here. So what this will do is allow you to click on this and you can modify the parameters of their activity. At the very top here, there's a description, which you can then bold, underline certain spots, whatever you want them to focus on, depending on what you want to emphasize. There's videos, there's modifications that you can make. So it's very customizable to the specific patient that's in front of you at that point in time. The nice thing too about this is you can either email this to them so they have it in email, you can text them, or you can print it off. So there's really no excuse for your patient not to be doing their home exercises because everything is right there at their own fingertips. The nice thing about this too is that you can go to your access code, and we're going to leave page, is that you can then modify it, or you can progress or regress them depending on how they're doing in the clinic, and everything gets stored under this same code. So it's really useful to say, okay, I just added this exercise in, or I changed this amount of weight. So everything's online. So if you forgot what weight you should use or how you should do it, just go and access it.